United Healthcare's contract with Brown University Health, Rhode Island's largest healthcare provider, has ended. While reports suggest this was a mutual decision, many United Healthcare policyholders in the state may now find their hospital options limited to emergency room services, depending on their specific plan or tier. This development further solidifies United Healthcare's reputation for problematic insurance coverage. Someone told me about their deep frustration that stemmed from a recent emergency with their mother, who was rushed to Rhode Island Hospital, part of Brown University Health Network, due to stroke-like symptoms. To her shock, her mother's insurance, United Healthcare, wouldn't cover her potential admission, stating the provider needed to sign a new contract. While the ER visit was covered, an admission would leave them with the entire bill. Thankfully, it wasn't a stroke, but her mother battling two serious issues, two infections specifically, AFib and sepsis, requiring immediate hospitalization. They tried to transfer her mother to the local Fatima Hospital, but their ER was closed, and they had no beds. At 2:45 a.m., they finally found a bed at Kent Hospital. If Kent had been full, her mother would have been admitted to Rhode Island Hospital, forcing them to bear the full financial burden. This situation is unacceptable, especially for our elderly. The stress of dealing with insurance bureaucracy while their mother fought for their life was overwhelming. They stated that they overheard a transport worker say, "This is ridiculous," and a hospital employee suggest, "Just stay, and when you get the bill, let them send it to collections," making them feel utterly insignificant. This experience has left them feeling helpless and outraged. I tell this person's story because it is a taste of what is to come for medical coverage in the United States under the impending Republican budget reconciliation package, dubbed the Big Beautiful Bill, which is poised to dramatically reshape the healthcare in the United States, likely leading to a surge in uninsured Americans and a reduction in federal healthcare spending. This is due primarily to significant alterations in Medicaid and the Affordable Care Act, known as ACA. The bill proposes nearly $1 trillion in Medicaid cuts over a decade, which could prompt states to tighten eligibility, reduce benefits, and lower provider payments. Furthermore, the bill is expected to complicate enrollment and maintenance of coverage through ACA marketplaces by shortening open enrollment, restricting special enrollment periods, and forcing stricter subsidy verification. According to a CNN analysis of the bill and Congressional Budget Office CBO forecasts, the CBO estimates that the Big Beautiful Bill will result in millions of Americans losing their health insurance, with some projections suggesting over 10 million people could be uninsured by 2034. These changes are likely to disproportionately impact low-income individuals, those with disabilities, and residents of rural areas. The bill's provisions may also increase healthcare costs for some Medicare beneficiaries. The Center for American Progress indicates that the proposed changes to ACA marketplaces could lead to higher premiums and out-of-pocket expenses for certain individuals and families. The bill does include a rural health fund. Its efficacy is subject to debate, with some arguing it could mitigate the negative consequences of other provisions on rural communities. Cuts to Medicare and Medicaid funding could have severe unintended consequences, including the closure of hospitals, nursing homes, and other facilities. Nursing homes depend on Medicare to provide end-of-life care for the elderly who are no longer able to care for themselves. Without this funding, many elderly individuals may be forced to leave the facilities that offer comfort and dignity in their final years, unless they are very wealthy. Similarly, hospitals in rural areas where populations are often poor or underinsured, rely on Medicaid funding to cover shortfalls in patients' medical coverage. This applies to both publicly funded and private hospitals. The loss of this funding could force many to close, potentially limiting or eliminating local medical coverage in those communities. This puts over 700 rural area hospitals on the chopping block. The ramifications extend further. Local pharmacies frequently establish their annual budgets based on anticipated prescription volumes. A significant portion of these prescriptions are often covered by Medicare or Medicaid, as many patients rely on these programs due to factors like retirement age, medical inability to work, or insufficient insurance coverage while employed. When patients lose essential coverage, they may forego unaffordable prescriptions. This trend can exacerbate the challenges faced by the retail pharmacy sector, potentially leading to a reduction in locations and staff, thereby limiting access to vital medications. We will also see an increase in the migration of doctors to other countries who are more friendly to supporting their healthcare efforts. Over the past 7 months, the Medical Council of Canada has observed a dramatic surge in American doctors seeking Canadian licensure. The number of American physicians creating accounts on physiciansapply.ca, the initial step in the licensing process, has increased by over 750% compared to the same period last year, rising from 71 to 615 applicants. Canada's largest provinces have noted this uptick in American doctors applying for or successfully obtaining Canadian licenses, with some explicitly stating their relocation is a direct consequence of Trump's policies. Another concern from the financial failures this bill will create is how this result will apply under filial responsibility laws. Filial responsibility is a legal concept in which an adult child is financially responsible for their parents' unpaid health care costs. Not all states have filial responsibility laws, and not all families are liable. In short, an individual could have filial responsibility if they have the means to pay for their parents' unpaid long-term case bills when their parents are not covered by Medicaid, but do not have the financial means to pay for them. These laws are on the books in 30 states. To sum this all up, we will pay more for what little medical coverage we can find, if we can find any coverage. Our parents and children will lose their coverage. Also, a few billionaires can have a relatively small tax break that they effectively won't even notice. Martin Luther King said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." That's all for this week. Until next time, remember, your voice is vital. Stand up, speak out, strike back. They don't know what they started. If you appreciate this content, please like, share, and subscribe. For updates, ring the bell. Your support is appreciated. It truly helps this channel.